Good evening, everyone. I'm Shalini Diwan, and welcome to my talk show. And with our talk show, we are on with Health Key Baat. And our topic for the day is women health and kidney diseases. Women health has
Good evening,
most
as a
important.
co-host. Yes.
Yeah, so let me introduce my guest speaker doctors with you. I have with me Dr. Vyoma Singla. She is a PhD in environmental chemistry. She's also a health coach and helps people gain their health back. So, welcome, Dr. Vyoma, to the show.
Thank you, Shalini. Thank you, Shalini.
And we have with us Dr. Bhanu Mishra. He is a nephrologist with B&K Max Hospital. So welcome, Dr. Bhanu, to the show. It's
Good
a
evening.
pleasure.
Hello. Same here,
It's
ma'am.
always a pleasure. Getting right information from the right people is the most important thing, and that is our motto for this talk show. So let's begin with Dr. Vyoma. Dr. Vyoma, I would like to know from you that hair fall. Well, can you explain what are the problems that are there because of hormonal imbalances in the body?
Okay, see, hair fall is experienced by every girl, every woman of B, if she's a girl, B, she's an adult, B, she is in an old age. So we should understand first what is the basic reason behind hair loss. So that is basically hormonal imbalance. हम सबने सुना ही है, हॉर्मोन्स होते हैं, हॉर्मोन्स इम्बैलेंस हो जाता है, किसी का हार्मोन बैलेंस होता है, but we should know what is actually imbalance. First, what are hormones? Hormones are like the chemical messengers from the glands to the organ. इन सिंपल लैंग्वेज में समझाती हूँ. इट्स लाइक अ कम्युनिकेशन. जैसे मैं आपसे बात कर रही हूँ, इफ माई मैसेज इज रीचिंग टू यू एंड यू आर एबल टू रिप्लाई टू दैट, देन hormone is working properly and there is a hormonal balance. And if I say, okay, Shalini diji, please अपना right hand उठाइए, आप नहीं उठा रहे, that message is not reaching to you. So that is basically hormonal imbalance. And वो होता क्यों है? We should know that. Primary reason is the food which we are eating, that is basically adulterated. उसके ऊपर insecticides, pesticides, herbicides सब स्प्रे होते हैं. आप सबने सुना है, सब बोलते हैं आजकल ऑर्गेनिक खाइए. क्यों खाइए? Because that is adulterated. And these insecticides, pesticides and herbicides, when they go inside our body, they block the receptor site at the organ. तो gland से जब वो hormone निकलता है and वो receptor site पे insecticide block हो गया, because it mimic like the hormone, तो मैसेज तो कन्वे हुआ ही नहीं उसको. तो दिस इज बेसिकली हार्मोनल इम्बैलेंस. एंड बेसिक रीजंस हेयर फॉल के हैं. स्ट्रेस, जिसमें कॉर्टिसोल लेवल बहुत इंक्रीज हो जाता है बिकॉज इट इज नॉट एबल टू बाइंड द ऑर्गन प्रॉपर्ली. सेकेंड इज एस्ट्रोजन इम्बैलेंस. ये यूजुअली पोस्ट प्रेगनेंसी केसेस में होता है या किसी को पीसीओडी है तब हो जाता है. एंड थर्ड केस जब इंसुलिन इम्बैलेंस हो जाता है, व्हेन पीपल आर वेरी हाई ऑन शुगर्स एंड कार्बोहाइड्रेट डाइट्स, तो उनका इंसुलिन लेवल बहुत इंक्रीज हो जाता है एंड दैट लीड्स टू हेयर लॉस. So these are the basic three reasons. These are the three hormones which leads to hair loss.
Well, I think Dr. Vyoma आपने बहुत अच्छे से explain किया है what is hormonal imbalance, because कई बारी लोगों को यही एक concept है जो समझ नहीं आता, and when your basic concept is not clear, you don't know how to go about it. So आपने इतने अच्छे से इसको explain किया, and I'm sure the audience have understood it very well. So going further, so now that we're talking about hormones, what is the role of hormones from puberty up to menopause? Because there are so many stages a girl goes through, from a girl to a adult, and then to a woman, and then she goes through different stages in life. So the ऊपर नीचे सारे hormones होते हैं, and she has to deal with them. So you tell us what are the roles of these hormones and how should she take care of them?
Okay, like everyone knows that female goes through countless changes right from the birth to the old age. Like
Yes.
जब वो पैदा ही होती है, like when the girl is less than 10 years, their hormones are not very effective. तब हम बच्चों को या गर्ल्स को ये बोलते हैं you should indulge in sports, और
Yes.
एक्टिविटीज लाइक स्विमिंग, जंपिंग, डांसिंग, स्केटिंग, इन सब करने से क्या होता है, उनके मसल्स की ग्रोथ होती है. दैट इज द टाइम फ्रॉम 0 to 10 जब उनका मसल ग्रो करता है. सो दैट हैज टू डेवलप इक्वली. देन देर इज अ ट्रांजिशन फ्रॉम गर्ल टू यंग वुमेन, and there
Yes.
the body changes inside and out. Okay, there is a change in body shapes, emotions आ जाते हैं, puberty kicks in, the girls get their first periods. So in सब में this everything is governed by the hormones, and
Okay.
during this period the girl is developing their body fully. So and there comes the high demand of nutrition, especially girls should take a well balanced diet, they should eat a lot of fruits, and they should opt for a calcium rich diet, because यही phase होता है जब उनकी bones grow करती हैं. Bones
Okay.
gain their maximum strength during this period for the rest of their life. First phase में muscle grow होती है, इस phase में bones grow होती है. तो it is just in this phase estrogen comes into the picture that will regulate the periods of the girl. And then comes the adult phase from you may say 19 to approx 35 and 40, and during this
Okay.
period a female gets juggled up with lot of activities. They go to the college, they develop emotions, different kind of emotions. Then they go for the career. That is also very hectic for them. Then they plan for a marriage. They think of having a baby. कोई न्यू मदर बनती है, फैमिली भी देखनी है. So there are so many activities they are juggling up. इस टाइम में luckily what is the good thing that they have the highest bone density and muscle density. They are very
Yes.
strong to cope up with all these activities. तो इस टाइम में अगर वो एक हेल्दी लाइफस्टाइल ऑप्ट करेंगी, सो इट इज दे विल फंक्शन एट देयर बेस्ट. तो दिस इज द टाइम during which they should take care, because they have so much responsibilities. उनको अपनी रेगुलर स्कैनिंग करानी चाहिए. They should consult a doctor regularly. अपने खाने पीने का ध्यान रखना चाहिए, because फैमिली भी है, बच्चे भी हैं, पेरेंट्स भी हैं. And then comes the old age where the females observe menopause. इसमें this is a significant milestone in every woman's life. इस केस में क्या होता है, your estrogen level decreases sharply, and this estrogen gets busy in developing health problems, be it a diabetes, be it a cardiac arrest, osteoporosis, anxiety, loneliness, and क्या नहीं, सब कुछ होता है, चाहे acne है. But अगर आप उसको healthily follow करेंगे, you can overcome this. Exercise is just the key during this stage. Exercise करेंगे, physically and emotionally आप happy रहेंगे, healthy रहेंगे. आपको
Right.
एडवाइस करते हैं आप फ्रेंड्स के साथ रहिए, फैमिली के साथ रहिए, अकेले मत रहिए, लोनलीनेस नहीं होगा, मेडिटेशन करिए, उससे आपको पीस मिलेगा. सो दिस इज द वे इट गोज फ्रॉम बर्थ टू ओल्ड एज.
Absolutely. Very well explained. And सबसे बड़ी बात है कि your mindset has to be very positive. You should see things in a very broader perspective, and you should be confident enough to handle all the situations that are coming. But again, it's possible only when they say you have a healthy mind and a healthy body. So a healthy mind and healthy body is very important, and both of these things go hand in hand. It's very important, right, for the girls. And we always say, please आप अपने आप को neglect मत करिए. Don't be the last one to have your food. बचेगा तो खाएंगे. No, you are a very important member of the family. You should make sure that you have a right nutrition. And I appeal to all the members in the family. कि आप make sure that the woman in the house is respected and taken care of with her diet, with her meals, with her emotions, and she's respected well, because that is how she will gain all her confidence. So, Vyoma, I think that was absolutely amazing and very well required for people to know this. So let's go further. Now, very common thing that we are coming across nowadays is PCOD. So PCOD, every second, person is talking about it, but a lot of people don't have a clarity for it. तो क्या आप ये explain कर सकते हो कि इसके causes क्यों होते हैं? Why is PCOD? What is PCOD and what are the causes for it and how to deal with it?
Okay, PCOD is very common these days. This is basically Polycystic Ovarian Syndrome. This is not a disease, it is basically a disorder. Okay. I'll try to explain you scientifically. Like everyone knows, ovaries release eggs. Eggs के around एक layer होती है androgens. So that androgen has to be converted to estrogen, which is estrogen is the female hormone that plays a role during periods, that helps in pregnancy. That estrogen, and there is a balance between estrogen and progesterone. So the basic funda is this androgen has to be converted to estrogen, and this
Okay.
is done by some enzyme. So what happens when we eat high sugar foods or food that is rich in carbohydrates, या जो chemical food होता है, या आजकल packed foods खाते हैं, उसकी जो coating होती है वो improper होती है, उन सब के
Okay.
थ्रू हमारे बॉडी में heavy metals आ जाते हैं. So these
Okay.
heavy metals actually block the pathway of conversion of androgens to estrogen. ओके, सो जब ये पाथवे ब्लॉक हो गया तो एक स्टॉक बन जाता है एंड्रोजेंस का. व्हेन देयर इज अ हाई स्टॉक ऑफ एंड्रोजेंस, तो ओवरीज फेल टू प्रोड्यूस द एग्स. तो एंड्रोजन का स्टॉक हो गया, वहां पे फॉलिकल्स डिपॉजिट हो गए आपके ओवरीज में.
Okay.
एंड जब मल्टीपल फॉलिकल्स आ गए, सो दैट इज द पीसीओडी. एंड ये होता क्यों है?
Okay.
बिकॉज ऑफ इम्प्रॉपर ईटिंग. हम केमिकल फूड खा रहे हैं,
Okay.
फूड्स खा रहे हैं, हैवी मेटल्स बॉडी में आ रहा है हमारे. अनदर ये 50% इज गवर्न बाय दिस थिंग. एंड अदर रीजंस
Okay.
होते हैं, जैसे किसी को बहुत ज्यादा स्ट्रेस है, उस केस में कॉर्टिसोल हार्मोन आपका बहुत इंक्रीज हो जाता है. दैट कॉर्टिसोल इज कन्वर्टेड टू एंड्रोजेंस. अगेन एंड्रोजेंस का स्टॉक हो गया. थर्ड रीजन इज इंसुलिन. जब आपके इंसुलिन लेवल बहुत हाई हो जाते हैं, ब्लड लेवल में आपका शुगर का क्वांटिटी, शुगर हाई हो जाता है, so this insulin IGF, insulin growth factor, is also converted into androgen. So
Okay.
due to all these three reasons, androgens is collecting up. उसका एक स्टॉक बन गया, and that is not getting converted क्योंकि हमारी बॉडी में heavy metals हैं. तो हम इसलिए वो कन्वर्जन नहीं हुआ, पीसीओडी हो गया, एंड द लेडी इज नॉट एबल टू कंसीव व्हेन प्रॉपर एग्स आर नॉट रिलीज्ड. सो दिस इज द रीजन बिहाइंड पीसीओडी. एंड आप इसको ओवरकम कैसे कर सकते हैं? आप हेल्दी ईटिंग करिए, आप ऑर्गेनिक खाइए, पैक्ड फूड्स मत खाइए, उसमें सिर्फ केमिकल्स हैं या हेवी मेटल्स हैं. आप जितना ऑर्गेनिक खाएंगे, दिस ऑल विल बी डाइल्यूटेड, इट विल बी हेल्दी. अपना न्यूट्रिशन लेवल मेंटेन करिए, स्पेशली विटामिन डी, विटामिन बी, जिंक, कैल्शियम लेवल आपका अप टू डेट होना चाहिए, आयरन प्रॉपर रहना चाहिए, आपको मेडिटेशन करना चाहिए, एक्सरसाइज करना चाहिए. जब आप ये हेल्दी प्रैक्टिसेस फॉलो करोगे, एक हेल्दी लाइफस्टाइल फॉलो करोगे, दिस विल बी ओवरकम.
Wow. And as Dr. Bhanu के साथ all the shows that we've been having, we've always stressed on balanced diet. You know, Dr. Bhanu हमेशा यही कहते हैं, balanced diet के ऊपर आप अपना ध्यान रखिए, because that is the basis for a lot of problems in our body. And even Vyoma is seconding it. So I think, you know, it's a very clear message to all the audience. Half your problems in your body is because of the diet that you take. So yes, we all know junk food बहुत tasty लगता है, दिखने में अच्छा लगता है, but actually is absolutely, you know, it's just too bad for your body to accept it. So please आप अपना diet के ऊपर ध्यान रखिए, and half your problems are going to be solved. So Vyoma, we now know about PCOD, हमारे को क्यों होता है. तो अब pregnancy में ये बताइए कि some people don't conceive, you know, as you said. You have covered this also, but will you also elaborate on it कि जब हम conceive नहीं करते हैं तो हम उसको, you know, और कौन सी चीजें हैं जिससे हम उसको overcome कर सकते हैं, and how long does it actually take? I know it's different from every person to person, but कितना एक roughly stage होता है कि where, you know, people, yes, you know, they can overcome this and get into a healthy body.
I would say, like, it is not standard for any body. It varies from female to female. तो फर्स्ट ऑब्जेक्टिव है हेल्दी लाइफस्टाइल ही ऑप्ट करना है आपको. हेल्दी ईटिंग करेंगे, आपका न्यूट्रिशनल बैलेंस आपकी बॉडी में मेंटेन रहेगा, योर ऑल द ऑर्गन्स विल बी हेल्दी, योर ऑल द ग्लैंड्स विल वर्क प्रॉपर्ली, हार्मोनल बैलेंस हो जाएगा. जब ऑल द हार्मोन्स विल बी सिक्रेटेड एट देयर टाइम, एट द रेगुलर इंटरवल्स, ऑल द साइकिल विल बी प्रॉपर्ली, सारी साइकिल अच्छे से एग्जीक्यूट होगी. तो जब सारे ग्लैंड्स प्रॉपर हो गए, ऑर्गन्स हमारे हेल्दी हो गए, प्रॉपर हार्मोनल सिक्रीशन हो गया, तो हमारा एंड्रोजन से एस्ट्रोजन कन्वर्जन प्रॉपर हो जाएगा. एंड व्हेन देयर इज सफिशिएंट अमाउंट ऑफ एस्ट्रोजन, तो एस्ट्रोजन और प्रोजेस्टेरोन की जो साइकिल होती है वो भी प्रॉपर्ली रन होएगी. तो द बेसिक फंडा इज यू शुड टेक केयर ऑफ योर न्यूट्रिशन. दैट इज द बेसिक थिंग. अगर आपने,
and I think lot of sports also, you should be, you know, going out more, meeting people, so because
you have to be active, you have to be physically active as well. And on an average आप ये समझ लीजिए 4 to 5 months तो आपको लगता ही है to regain your health. You should exclusively spend time on healthy eating, exercise, meditation, and all these things will definitely help. And nutrition आपका अगर up to the mark रहेगा, कोई problem नहीं होएगी. All the organs will work properly. जब organs की functioning proper हो गई, सारे glands हमारे properly function करेंगे, all the glands are in their place, तो हमारे all the hormones will be secreted properly. जब हमारा estrogen is in its place, there will no कोई problem ही नहीं आएगा pregnancy में.
Absolutely, this is so well explained. And guys, it's never too late. Listen up, you just decide to be going on a healthy side of your, lifestyle, and you're healthy. You want to have a healthy body and a healthy lifestyle. It's never too late. Just get up and just do it. It's not. Now, when we're talking about women health, what, we would also like to know, Dr. Bhanu, कि आप ये बताइए कि कौन सी कितनी issues होते हैं that women face. So it is very important to touch this topic also.
Absolutely. There are a few points which I would like to add in PCOD, and the most common of that is the obesity. Of course, a healthy diet is a part and parcel of that, but obesity needs to be tackled as the primary reason for PCOD. And the reason to become childhood obesity is also on the rise, as we did a discussion in our previous topics of pediatric and kidney disease. So obesity is a very, very big factor that comes in with PCOD that needs to be tackled. And with obesity and PCOD, there is a syndrome called Syndrome X, which is also called as a metabolic syndrome. And all of this is a part of higher cholesterol, a higher level of insulin in your body, and obesity, PCOD, a little bit of diabetes. These are the things which you will see in metabolic syndrome, and PCOD is a part of that. You need to understand. And this is a vicious cycle. So to break it, the first thing that you can do is to do a weight loss is extremely important. That is one aspect. Second, you need to understand this is the first issue which I would like to talk about is obesity, which causes PCOD that we have just touched. The other thing that you need to see is the nutritional aspect of it. The most important of which I want to cover is the iron in our diet. Most of our people in India are still vegetarians, and in vegetarian there are iron-rich diets, but not as much as the non-vegetarian diets. People have a lot of food fats with them, and they tend to eat less iron in their diet. Now, if you ask a standard female, irrespective of their background and their profession, many of them are extremely tired by the end of the day, and whenever they get up, because of the work pressure or social pressure, sometimes they have to get up. As if you ask them properly, if you take a history properly, they will tell you, no, they don't feel like getting up. They are very tired and things like that. And the most important reason for that is the iron deficiency in their body. Okay. And one more thing that you need to take care is, even if your hemoglobin is normal, you could be iron deficient. This is one of the topics that I'm going to cover in one of my individual webinars soon enough. Even if your iron hemoglobin is normal, you could be iron deficient. So because hemoglobin is the last thing to fall. When iron goes down in your body, hemoglobin is the last thing to fall. It's not the first thing. Your storage of iron goes first, then your circulation, and then the hemoglobin. Body keeps the hemoglobin intact till the last. So you have, when you're suspecting something like this, where your iron is low, which could be suspected, as I just said, fatigue, inability to do the same job that you were doing some time back, asthenia all the time, please check your iron profile. And I can tell you with my own experience, if I've done 10 iron profiles of a standard Indian female, 6 to 7 out of them were heavily deficient of iron. Very rarely I see a normal iron in an Indian female, irrespective of social background, irrespective of economic background. So it's extremely important. So apart from obesity and this iron deficiency and anemia that needs to be seen. Third thing is that you need to see the female faces a problem is during the menstrual cycles. It is part and parcel of the iron deficiency. A lot of this is a social stigma. A lot of people are still not talking about it openly to their gynecologist, to their physicians, even in their peer groups. This is a topic which still people don't want to talk about properly. Yes. And sometimes they get, the disturbances related to it can cause a lot of mental stress to the young female because she's due to this that she's facing. She gets a lot of psychological trauma to this. They always feel that this is happening to me only, and this is a problem that is related to me. Other all people are fine. This is absolutely not. Menstrual irregularities and menstrual problems are very, very common. We just need to be more open, and platform like this, where we have a female of different age groups, can come together, and this social stigma has to go. This is a second thing that you need to understand, that menstrual irregularity is a very common thing. Now coming
नहीं,
to
absolutely, Dr. Bhanu, you said it so well and you nailed it so well कि ये एक टॉपिक है जिसपे I think we have to do repeated, webinars, repeated talks about this, because people have to open up. You have to open up and talk about it, be vocal about it.
absolutely. Second thing is about related to pregnancy, and this is actually a very huge topic to cover on this platform. But what I would like to say is, having a pregnancy is a heavy toll on a female body, and it has to be well planned, it has to be timely planned, and it has to be a booked pregnancy. By the meaning of booked pregnancy is you have to be under the guidance of a registered medical gynecologist or an obstetrician, and nothing short of that. It could be a government, it could be a private setup, wherever you feel is based on your choices, but it has to be under a registered practitioner. All your medicines have to be taken regularly. The calcium, iron, and vitamins have to be taken properly. Your vaccination has to be on time, because it's not just you. Because what you do during pregnancy affects a lot to your child. It could be the girl child. If you are not taking your nutrition properly, your organs are not matured properly, then girl child is already suffering inside, and by the time she will be born, or reach the same stage, they will be deficient right from the womb level. So you need to take care of the child. If you are healthy, 90% of the time your child will also be healthy. So you have to take care of that. Second thing, because of the education, which is education, and the inspirations of young female to be good in their professional careers, people tend to delay their marriages and tend to delay their pregnancy, which is absolutely fine. Not every female has to or every male has to marry into the kids. It is your personal choice. But if at all you have this kind of thought in mind that you need to get married and start your family, it is always advisable to do it right on time, when many things will go on. It is not going to be easy. Being a doctor, I can tell you, it is extremely difficult to this is your time where you make your career, and high-end jobs require a lot of time and dedication. It's very difficult to do this, but you have to understand, take a step back. Everything has its own time, and try to do it well within your biological clock time if it is possible. It is absolutely a female's choice to do it. There cannot be a social pressure, even from your own parents or your husband. It has to be the woman's choice. But the only thing that she should understand is the scenario, the age that she goes under. Because later on, if you choose to become, you have to undergo a lot of treatment, which is not good for your health in long term. So that is also one aspect. Second is, during pregnancy, like I was saying, it should be a booked pregnancy. You have to check regularly about the sugars and blood pressure during your pregnancy. It is a very if you are under a regular follow-up, your doctor will tell you. But many a times, healthy women don't get any symptoms during their pregnancy, and they feel ये तो बहुत normal सी बात है, क्यों check कराना है, बार-बार जाने की क्या जरूरत है. Many a times, to save some pennies, they lose a lot of gold.
Yes.
So please get your health checkup regularly. Please do your glucose tolerance test during your pregnancy. I'm sure anyone who has gone under pregnancy will know what is glucose tolerance test. Your blood pressures have to be checked. Keep yourself healthy before you embark a journey of pregnancy. If any of your body aspects are abnormal based on your sugars, blood pressures, weight, even the social aspects you have to manage well, then embark on the journey of pregnancy, because it is going to be happening once in a lifetime. The first pregnancy is extremely crucial. So a lot of things are there we have to be vigilant about. Second things, coming to pregnancy, there are a lot of changes that happen in the kidney. A lot of changes. Kidney volume increases by 50%. A lot of blood flows through through kidney during pregnancy. So you have to take care of your kidney, and for that, aches and pains, body aches are part and parcel of pregnancy. No matter what you do, you're going to get that backache, you're gonna get that leg ache, and you will feel fatigued, you will feel pain maybe in any part of your body. Please make sure that you are choosing a analgesic, a painkiller after a medical consultation, and not the drugs which are available over the counter. It can damage your
Okay.
kidney, and most importantly, your child that is going to come. So it becomes very important. If you're a hypertension patient already and you're planning for pregnancy, make sure that your drugs are checked by the physician, that they are safe to embark on the journey of pregnancy. If you're diabetic, make sure that your drugs are safe to embark on the journey of pregnancy. Many a times, and it should be a planned one. Like I said before, it should be a planned one. You cannot, especially in this modern era, you should plan it properly. See that your drugs that you're taking, if at all you are suffering from any illness, are well within the range that you can become pregnant on them, and then you should do. A very common disease which affects kidney a lot, and it is 10 times more common in females, is SLE. It is called as systemic lupus erythematosus.
Okay.
It affects a kidney in a big way. It is a very, a person who's suffering from it will know everything about it, and a person who's not suffering from it probably will not even know the name. So SLE is a disease. It is an autoimmune disease, by which I mean your own body produces antibody against your own cells, and which it is a systemic disease. It can affect you right from your brain to heart, your kidney, and many other aspects. So please make sure that you're not suffering from any of this, and if you are, you should be in consultation with your physician, nephrologist, your gynecologist, and with a multidisciplinary approach to embark on the journey of pregnancy. So this is extremely important. And as
Absolutely.
we discussed with Dr. Vyoma also, once you reach a journey where you're ending you're reaching a menopausal age group, your bones, your muscles become weak. Like Dr. Vyoma said, your hormone level changes are coming. In the last 1 to 2 year, 1 year of your perimenopausal period, there are a lot of changes that come, and your risk factors of heart diseases, your risk factor for kidney diseases increase markedly once you're menopausal. Your fracture risk of your bones increases markedly. I can give you an example. Currently, I have 3 females of 75 age, around 70-75 age. All of them have a hip fracture. One is almost not going to survive the next morning, and 2 are extremely serious. So it becomes a fracture in your hip at the age of 70 is as bad a disease as heart attack or a cancer. So please take care of your bones. They're extremely important. And let me tell you, these are extremely neglected organ of your body. Nobody tests your bone. There are no direct tests of your bone. So you have to do, get yourself physically examined. A lot of people, if you have noticed, in the lower legs, just above your feet, you press them and they have a lot of pain in their bones. And, sometimes you feel, so, she's faking it. It could be sometimes so painful for a lady that if you touch on their tibia and the lower legs and you press a little and they'll shout. So you feel,
Yes.
she's saying simply, it cannot be that painful, but sometimes it is. And the underlying cause can be your bone pains, your
Okay.
osteoporotic bone. So that is extremely important. And diet, like Dr. Vyoma said, calcium-rich diet is extremely important to keep your bones healthy. Vitamin D is extremely important. People are sitting in their cars, ACs, no sunlight. Vitamin D is not going to come that way. So please increase in your diet. Consult your physician so that you know how much vitamin D is needed. Don't take it left, right, and center. It could be harmful the other way around also. If you take a lot of vitamin D, we have seen very often vitamin D is stored in your fat. It goes out it's very difficult to take out from your body. So don't take over-the-counter vitamin D capsules, and don't fall into a prey of marketing gimmicks where they keep telling you this is multivitamin, this is nutritional, and you keep taking it. Especially during this COVID time, this marketing gimmick of multivitamins and nutritional capsules have taken over everybody's mind and brain. So please don't fall into that. A balanced diet that is there in your kitchen is more than sufficient.
Absolutely. No, very, very well explained. And I think, these small things, if we monitor in our day-to-day life, is going to be phenomenal for our, a healthy living, a healthy body, and a healthy lifestyle. So, the doctors, you have explained everything so well. But, one question that I throw to both of you is, how do you manage stress? Because ये एक ऐसी चीज है जो आजकल everybody is going through it, right from children to adults, to women, men, name it, and everybody is going through it. So, just
I
both of you just put down. Yes, how do you manage stress?
I'm sure Bhuma will have a better way to answer this question, but I would like to say a lot of diseases are just termed on stress. And in my mind, I may be wrong, stress is overrated as of now. You know, if you stress
Right,
is a little
absolutely.
overrated, little overrated. Let's not call, I'm sitting in a car trying to reach the ICU, talking on your phone. This is not stress. This is something which I want to do. And,
Yes.
I can keep saying that I'm in a lot of stress. People are calling me here and calling me there. This is not stress. Sometimes the job that you are in, chosen by you, the job that you love to do, still gives you a lot of stress. So, trying to achieve something and getting, roadblocks in it is part and parcel of your career, part and parcel of life. Don't push everything that is going on stress. The biggest example that I can give you, a lot of people undergo, a lot of females, a lot of couples, a lot of go under a lot of stress. And if you see someone on the road, the people sleeping on the road have, like you were saying, you were saying people are not able to get pregnant and things like that. You see a lot of people on the road, they have 4 kids. They have 4 kids running around and things like that. What more stressful could be to just lie on the road? So stress is a little overrated. It is actually your mind playing. So try to relax yourself. Keep a good diary of time management is more important. If you cannot manage your time, you will always be stressful. So try to keep yourself well within your time range. Keep a time schedule. I think that is the motto which I would want to give every young person around to make, keep them less stressful. That is all I have to say. I'm sure Vyoma will have much more ways of saying as a life coach.
Like Dr. Bhanu has explained this very nicely. Like I will reiterate the example of Dr. Bhanu. He said, okay, I'm sitting in a car and I have to reach some destination. It should not be taken like a stress, but it is basically the mindset. There may be another person in place of you and he would be like, नहीं मुझे जल्दी पहुंचना है, मेरा ये काम अटक रहा है. ऐसा ये सिर्फ माइंडसेट का प्रॉब्लम है, ऐसा नहीं है. आपको टाइम उतना ही लगेगा वहां पहुंचने में, जस्ट माइंडसेट का है. आप अपनी हेल्थ को वो स्ट्रेस दे रहे हो, दैट इज अनवांटेड स्ट्रेस. तो इट इज द प्रॉब्लम ऑफ माइंडसेट. आप जितना टाइम जिस चीज में लगना है वो तो लगेगा ही. अगर आप पीसफुल होकर वो काम करेंगे तो वो स्ट्रेस रहेगा ही नहीं. अभी जैसे लेडीज को फॉर एग्जाम्पल मेनोपॉज आ जाता है, तो साइकोलॉजिकली लेडी स्टार्ट थिंकिंग, ओके मुझे नी में पेन हो रहा है, मुझे नी ट्रांसप्लांट कराना है, बट इट मे नॉट बी एक्चुअली इफ यू डोंट थिंक इट लाइक दैट वे. So the best thing is you should indulge yourself in the activity that gives you pleasure. जबरदस्ती कुछ नहीं करना है, चाहे निटिंग ही कर रहे हैं, सिलाई ही कर रहे हैं, डांसिंग कर रहे हैं, बुक पढ़ रहे हैं, जो भी करना है that you have to do for the pleasure, not to stress your body. You have to de-stress. वो एक विशियस साइकिल में नहीं फंसना है. ओके ये हो रहा है, ये मेरे साथ ही हो रहा है, तो मुझे ये मेरे साथ ही क्यों होता है, ऐसा नहीं सोचना है. जस्ट अपना माइंड से सेट करना है कि मुझे ये चीजें करनी है. एंड यू शुड प्लान ऑल योर एक्टिविटीज इन द डिफाइंड टाइम, एंड उसको प्लान के अकॉर्डिंग चलेंगे तो स्ट्रेस ऑटोमेटिकली रिलीज हो जाएगा. तो स्ट्रेस आपकी ही थिंकिंग का एक साइड इफेक्ट है. इट्स नॉट नेचुरल. एंड in that case that hormone rises so drastically कि वो आपकी हेल्थ को इफेक्ट करता है. हम ये नहीं सोच रहे हैं कि इंटरनली हमारे हेल्थ को कैसे इफेक्ट हो रहा है. हमने स्ट्रेस लिया, हमने टेंशन ली, कॉर्टिसोल लेवल एकदम स्पाइक कर गया, वो फिर अंदर बॉडी को इंटरनली डैमेज करता है. तो इट्स अबाउट यू, हाउ यू प्लान योर एक्टिविटीज, एंड उसको स्ट्रेस लेना है या एज अ एंजॉयमेंट लेना है, दैट ऑल डिपेंड्स ऑन यू.
And I'll also add to both of you, आप दोनों ने stress को समझाया. It's a very small thing that I run my organization and everybody says कि in my school is 2.5 kilometers, 2.5 hours it takes me to reach that school. But everybody says, why do you take so much of stress to go all the way to the village to do it? And I say, this is not stress, it gives me a lot of pleasure. So ये मेरे लिए एक happiness का एक है. This is my passion, this is my happiness. The sparkle I see in the children's eyes, the smile I see on their face, this is my stress buster. So this is not a stress. So as you said, it's all about your mindset. आप अपनी किसी भी चीज को किस तरीके से देखते हो. And please, as Vyoma is saying, do what you like. किसी भी चीज को आप प्रेशर के अंदर मत करिए. जो भी आपका पैशंस है, जो भी आपके इंटरेस्ट है, जो भी आपकी एक्टिविटीज है, जो बेशक आप बचपन में एंजॉय करते थे, rediscover them, redefine them, and please do it. Don't bother about what the world is going to be saying. It's all about you. You have to take care of yourself, and that is what is important. The world is not there to take care of you. तो आप अपना ध्यान खुद रखिए. So before we wind up, now just a very small just on self care tips. कि आप दोनों self care के लिए just give a few tips to our audience कि वो क्या करें.
First thing that I would want to say is, which we have covered in previous topics, is please choose a day. It could be your birthday, it could be your anniversary, it could be your kid's birthday. Choose a day. Holi, Diwali, Dashara, Eid, doesn't matter. Do your health checkup once a year.
Yes.
Do your blood testing once a year. Do your urine testing. Do an ultrasound. If you're around 40s, do your heart checkup as well. That much amount of money spent on health is absolutely worth it. People who don't have money, I would say please buy one less shirt in this year and do your blood test.
Right.
This is extremely, extremely important, because if you, and do it not because you have symptoms, do it because you don't have symptoms, and you should never have symptoms.
Yes.
The moment you already have symptoms, body will not give you, body is such a complex organ, it will not give you symptoms till the time it is exhausted already.
Right.
So you have to check it annually, at least once annually, in whichever day you want to choose, and please inculcate this habit into your family, to your children, so that they follow the same thing in their life. And I am not from a medical, my parents are not doctors, and I can see in them as well so much reluctance, so much inertia. If I tell them to do a blood checkup, they say, no, we are doing fine, it's not needed. Why to waste money on that?
Yes.
This is a common
Right.
reply that I get even from my own parents. So
Yes.
please don't do that. Once a year, testing and a little bit of penny spent on that is absolute worth it. And life insurance, it's like a life insurance. So you
Yes.
should take a life insurance, of course, a health insurance, of course, and at the end of it, do testing. And I hope you don't require health and life insurance ever in
Yes.
at least in
Very
the
important
younger age.
self-care tip. The most important self-care tip that you could give to the audience. Yes. Vyoma, आप बताइए. Yeah, please go.
Shalini, I have just reached the hospital and I'll have to take your leave. Thank you very much for inviting me. And
Thank you.
please, Dr. Vyoma,
Yes.
thank you very much for joining in our talk show. And we'll call you again very soon. Thank you.
Yeah.
Yes. And thank you, Dr. Bhanu. You were absolutely a pleasure. Yes. Yeah, Vyoma.
So, in addition to Dr. Bhanu, whatever he said, yes, I am also in the favor of that. Yes, you should go for annual checkup, and especially
Yes.
females, they should go for the regular screening of their breast and uterus, because breast cancer and uterus cancer are very common after the menopause. Secondly, you should you should do exercise as a ritual, like it should become your habit. Why I am
Yes.
emphasizing on exercise again and again? आप नेचुरली जब एक्सरसाइज करते हो ना, तो एक केमिकल रिलीज होता है आपके ब्रेन में, दैट इज
Yes.
एंडोर्फिन. सो इट इज अ नेचुरल पेन किलर. वो हॉर्मोन्स भी बैलेंस करता है, आपका मूड भी बूस्ट करता है, एंड इट्स अ नेचुरल पेन किलर. तो एक्सरसाइज शुड बी अ रिचुअल फॉर ईच एंड एवरीवन, बी इट द फीमेल फॉर एनी एज, चाहे वो मेल है चाहे वो फीमेल है. एक्सरसाइज शुड बी अ रिचुअल. सेकेंडली, वी शुड डू अ हेल्दी ईटिंग. जब आप when you are a girl less than 10, that times your muscles is growing. When you are from 10 to 19, your bones are growing. From in the adult age, you have so many responsibilities. You became new mothers. That time also your body has to go so many changes. In the menopause also. So be it at any age, you have to maintain a ritual of healthy eating. You should follow a healthy lifestyle. आप ये सब चीजें फॉलो करेंगे, रेगुलर स्कैनिंग, रेगुलर कंसल्टेशन विद द डॉक्टर, हेल्दी लाइफस्टाइल, एक्सरसाइज, you will take care of yourself. And it should be the healthy aging. ऐसे नहीं कि ओके मैं आज से ध्यान रखना शुरू करती हूँ, एकदम सडन से एजिंग हो जाए. आप शुरू से ध्यान रखेंगे, it will be a healthy aging and you will enjoy all the phases of your life.
Absolutely, so well said. So Vyoma, it was absolutely a pleasure having you. And best is आपने इतने अच्छे से सारी stages and all the things that a woman goes through, आपने बहुत अच्छे से explain किया. And again, I will again tell the audience, especially the women audience, please take care of yourself. And to the audience, please respect your women in the house, take care of them. They are the basis, they are the pivotal role that they play in your life. So make sure that they are happy, healthy, confident, and they are glowing with lot and lot of love. So
They are the
Dr.
pillars
Vyoma,
of your home. They are the
yes,
pillars of your home. You have to take care of them.
absolutely. So I would just, before I wind up, audience, just connect to Dr. Vyoma for anything that you need guidance regarding your health. I'm leaving her number here. So please connect to her. Feel free to connect. And Dr. Vyoma is always going to be there because she's a very beautiful person inside out. She's always there for you and she will help you take care of your health. And Dr. Bhanu is always there with any issues that you face regarding your kidney problems and you want to discuss with him, please feel free to connect with him. So it's really a pleasure having you, Roma. Thank you so much for joining. And
Same here.
we will have you again back on our talk show, with you. So thank you, audience. It was a pleasure, and please be connected to us and do subscribe to our channel to know more about what we are doing in Healthy Baat. Thank you and take care.